So what we have here are two brains, one without dementia and one with dementia. Now, if you had somebody in your life who had congestive heart failure, what's a common symptom of somebody in congestive heart failure? Shortness of breath, somebody who gets short of breath. Would you ever go up to somebody short of breath with congestive heart failure and say, you need to breathe better? You're not breathing like you were yesterday. You need to get your heart and your lungs better coordinated. I mean, what is the problem here? I think you're being stubborn. Oh, no, you're not. I have seen you do better than you're doing. This is ridiculous. Would that work? Would you do it? No, because it's stupid. I mean, congestive heart failure is organ failure. There's no reason to do that. How about somebody who has kidney failure? Would you ever walk up to somebody in kidney failure and say, I need you to lean forward a little bit. Lean forward. Go kidneys! Now listen to me. Do you not want to pee? Well, you need to get your nephrons to process more fluid. I have seen you pee better today than you've peed in today. Okay, you can pee better than this. Don't be so lazy. I mean, you have got to get your kidneys working. Do you want to be on dialysis? Would you ever do that? No, it's stupid because you know kidney failure is organ failure and you can't do any better. Well, here's what you've got to realize. This is brain failure. This is as surely organ failure as any other organ. The problem is we can't see their head shrink. This happens inside the skull. If we could see their head shrink, I think we'd be more forgiving. And here's what I mean. We can have somebody who we know has a diagnosis of dementia. We know that they clearly have the diagnosis. And yet I will watch time after time, caregivers, truly caring people, walk up and say things like, you need help to go to the bathroom. Don't get up by yourself. You're going to fall. You need to call somebody when you need to get up, okay? Okay? Look, if you need to get up, use the call bell. Call somebody. Where's your walker? Where did you leave your walker? Which of the two of us has dementia? I mean, you just go, wait a minute, think about this. I mean, she has no memory. It's not a question of her not choosing, and this is my least favorite behavior, and this is one we've got to stop. Hey, Mom, which one am I? Say my name. Come on, you know me. Mom, look at me. You know me. Who am I? Mom, remember? This has got to stop. I mean, this is basically any other organ, we wouldn't tolerate this, but we do it to people with dementia all the time. We've got to acknowledge what's gone and quit whining, quit fussing, and quit trying to make them do what they can't do. And we've got to learn how to help them use what they still have left. And they will always have something left. The challenge is letting go of what's not there. Acknowledging it, letting go, and using what they still have. So let's talk about some parts of the brain particularly. And the one area I want to start is where this disease starts, because it starts in a very predictable place. And it's called the hippocampus. This is the learning and memory center of the brain. And what we have here, this area right here, this is where you learn new information. And it's also where you store memories of your life. This is your memory of your life. And so what happens first, this is the end of the disease. What do we have right here? A great big hole. This is what disappears first, new information. They can't hold on to new information, but they're very good at old information. They're very good at their old memories. But after the initial period of time, now what starts to happen is this disease destroys not only this, but more and more of it. And so what happens is they lose their life, but they lose it from now backward. So they lose the most recent part of their life first. So they can't remember what happened earlier today. But if I have clothes on, my assumption, because I have a lot of long-term memories that tell me this, is that I got up, I got washed up, I put on my deodorant, I put on fresh underwear, I put on fresh clothes, I've had breakfast, I had coffee because it's now 3:30 in the I actually had lunch too. I don't actually know whether that happened today or not, but I think it has. Now, what if I've started sleeping in my clothes, and I'm still living by myself, and there's nobody to cue me up? What might I not have done that I thought I did? Change my clothes, take a shower, eat breakfast, eat lunch, take my medicine. And yet when my daughter calls and says, Mom, did you take your medicine? What do you think I'm going to say? Yeah, Yeah, of course I did. Why wouldn't I? The new medicine? Well, yeah, all the medicine. Ask me what I had for breakfast. Well, the usual. Oh, whatever's in the fridge, I just fix something. You know how it is. Sometimes it's the cereal and sometimes it's the hot food. Whatever it was. This morning I think I had cereal and bananas. Now, you do my shopping. There were no bananas. So you say something about it. Oh, well, the lady next door, I had her go get them because I wanted some. I'm supposed to have potassium. Now, I am not actively lying, and this is the hard part for caregivers to accept. I'm not lying. My brain is making up information to fill in the holes because I don't like being stupid, and it just makes it up, and it tells me it's the truth. I'm not choosing this information. My brain is tricking me. It literally thinks. Because that's what happens when I have these holes. Then, eventually, it's not just an hour or so, and this also means I could be in some place for 3 months, and I say things like, I've just moved in here. It also means I haven't had anything to eat since I got here. They haven't fed me. And I just got up from the table. I had a lady crumbs falling out of her mouth who said they haven't given me anything to eat. And it's like you want to say, where are the crumbs coming from? But you have to stop doing that because you can't make their reality and your reality match. Until we learn how to heal that hole, their reality and our reality can never be the same again. And that is hard for us to accept, but it's very real. The next thing that starts happening is it's not just a day or a week. It's years of my life start disappearing on me. And I can't remember. I lose 5 years, and then 10 and 15 and 30 and 40 years of my life disappear. And all of a sudden, although I'm 85, I think I'm 22. I actually see myself as I was when I was 22. I'm living where I was living when I was 22. My situation, the others around me are as I was when I was 22. So I come out of my bathroom and I say, hey, listen. Can you do me a big favor? Listen, sweetheart, there's some old woman in my bathroom and she won't get out. I need you to do something. I don't know what's going on. She won't leave. I've asked her. Now, you go in the bathroom. Nobody in there. So you come out, and our traditional thing that we will say is, what would you say?
I didn't see anyone in there.
You didn't? Well, she must have left. Well, thank you. I appreciate your help because she wouldn't leave when I asked her to. And I go back in the bathroom and you see, what are you doing in here? Don't you shake your damn finger at me. This is ridiculous. This is my room. And you suddenly realize I'm looking at myself in the mirror and I see some old woman and I don't realize it's me. I think there's another person in my bathroom. So what is our solution? Cover or take down the mirror. And it's not just mirrors. Sometimes what we have to do is TV sets at night because I think people are coming in my room at night. Sometimes it's glass doors where people are trying to get in. See these people trying to break in? I also don't always recognize people's relationships to me. Hey, I know you, don't I? Who are you?
Mom, it's me. It's Jody.
Jody who?
I'm your daughter.
Shit. Honey, you're older than I am. Who are you really?
Oh, Mom. It's just me. It's Jody.
I don't know who you are. Who are you? What are you doing here? What do you want? Get out of here. Get out. Get out. I don't know what you're up to, but you're not any I've got a little girl, but she's not but 2. Now, what do you realize in that moment? I'm lost in time. I'm lost in my life. This is not a choice that I'm making. This is really I'm lost. And what you did is you tried to demand a relationship I can't hang on to because I'm 22, and I'm sorry, but you're older than 22, aren't you?
Oh, yeah.
Yeah, so it doesn't make any sense to me because I actually think I'm younger than you are. So here's what you're going to do. Instead of introducing yourself by relationship, give me just your name and do the connection. Say, well, hey, Teepa, how are you? It's Jody. Just do what we did when we did the positive physical approach. Just try it and see what happens. Hey, I know you, don't I? Who are you?
Hi, Teepa. It's Jody. How
Well,
are you?
hey, well, I'm Jody.
Yes.
Well, oh, my God. Well, Jody, what's your middle name, sweetheart?
Lynn.
Well, you're not going to believe that that's my little girl's name.
Aw.
Did you know that? That Jody Lynn.
Tell me about
Yeah,
that.
well, listen, here, look, here, let me go get a picture.
Okay.
Hang on, wait, oh my God. You look, she has the same color eyes as you. Well, wait a minute. I'll be right back. Whoa, whoa, whoa. Now I turn around, and here's the weird part. I pick up your wedding picture. But the reason that happened is you did supportive communication, not confrontational communication. And brain cells that haven't talked to each other in a while went, oh, Jody Lynn, click, 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 click. And then all of a sudden, here's the kicker. There she is. Oh my God, hey sweetheart, well when did you get here?
Hi, Mom. How are you?
Well, I'm fine. Look here, there was some woman looking for you. I don't know where she went, but she wanted to see you when you were pretty.
Oh, okay. That's very nice. Very nice.
Look what happened to you.
Exactly.
Now, can we have a moment of joy? Yeah, but who had to let go of the past? Because whose reality are we in? It's called go with the flow. You go with my flow. You don't try to push your agenda on me. You don't try to push reality on me. You just go along with my flow. And as long as you're willing to do that, we can have a better relationship, because we have a new relationship. Whether I recognize you as my daughter or just a nice person, it's okay. But you know who has to be okay with it? You. Caregivers have to relax. You have to let go of the old to be in the new relationship that I can give you, because that's all I can give you in that moment. Now, as this gets worse and worse, I can get lost in time, because what happens is I keep emotional memories, but I can't hang on to the specifics. And so things that happened a long time ago can suddenly be happening right now for me. Listen, I can't stay right now. I've got to get to the hospital because my husband is having a heart attack. Honey, can you give me a ride, please? Please.
It's okay.
No, it's not okay. He's sick. Now, you did a classic, traditional kind of response when I'm getting emotional. You want me to what? Calm down. You want me to be okay. Telling me I'm okay when I'm upset makes me what? More upset, because what you're denying is where I'm at emotionally. So instead of doing that, we have a new technique, and what it's called is empathy and validation. Empathy and validation. So instead of trying to calm me down, first you go where I am. You come to where I am emotionally. So you say, sounds like you're really worried about your husband. Yeah, and then you can say, that has got to be really horrible, really scary. He's having a heart attack. That's got to be really awful. I am so sorry that's happening. Are you sorry it's happening? Yeah. And then you say, now, tell me, you and Dick have been married a long time, haven't you? Now, what this means is, what had you better know about my husband? His name, our relationship, what happened. Right. What this says is, you've got to know me. You've got to know my life history. You've got to know my people. You've got to know what's important. And here's what I'm going to tell you. If you were smart early in the disease and you listened to my stories when I told you them over and over again, you have a lot of information. And this is one thing families can do that's really helpful, is fill out an information and a history sheet on work history and life history and family history and events that happened. Hot buttons, chill out kinds of things. My religious background, my faith background, my food preferences, all kinds of information that help us as caregivers then later on in the disease. This is her favorite thing. When she is unhappy, she prefers. These are things that are real important to know as caregivers, so that when I'm no longer able to tell you what I need, you have a history that's going to help you out, because that's what's going to matter. Okay? So knowing what's important about me. Now, this lady that I'm telling you about, she was real. She was a real lady. And what had happened is 30 years prior to this, her husband had a heart attack at the hospital, and she received word that he was having a heart attack. Before she could get to the hospital, he died. Now imagine she is stuck in that moment of knowing he's really sick and he has the potential to die. And somewhere in her brain is the knowledge she doesn't make it. How frantic is she to get to the hospital? And so how about we have a cup of coffee? How about why don't you come with me? It'll be okay. Is that making any sense? What's making sense is, oh, Teepa, oh my God, that has got to be really scary. I am so sorry that is happening. I know you and Dick have been married a long time. Yeah. Tell me about him. and tell me about him allows her to start talking about Dick. And what I want to do, it's called redirecting. I want to take her back to a time in their relationship that is less scary. But I've got to start where she is and then help her move away from there. I can't make her be different than she is. I've got to start where she is. Now, this section of brain is a different section. This section of brain has to do with how you understand what people say to you. It's the temporal area. And what we have here, this chunk right down here, you see this chunk? This is your ability to interpret and understand words that people say. This is what it should look like. And this is all that's left by the end. Up here is your ability to hear sound and hear words. And they can actually hear just fine. Alzheimer's and dementia doesn't change your ability to hear. It changes your ability to understand. But if you don't pay attention to that, what can happen is, hey, Judy, I'm going to get you something to eat. Which would you rather have? Would you rather have ham or turkey today? Because I can get you either one. And the person goes, huh? And I go, ham or turkey? And Judy wants to know why I'm yelling at her because she just was going, huh, because she didn't understand, not that she didn't hear. And the number of times that we will hear people with dementia go, huh, and we raise our volume. What we don't need to do is raise our volume. What we need to do is slow down and give fewer words. Early in this, people will miss out of 4 words. How long would it take before do you think? Early in this disease, people will miss 1 out of 4 words. How long would it take before you got lost, do you think? 4 sentences. You had not a clue what I was talking about, and all I did was drop every 4th word. By mid-disease, it's 1 out of 2 words. And by the end of the disease, all they hit is 1 word, but it's totally out of context. So say something to me like, it's about time for lunch. I don't need to pee right now. Yeah.
It's time for lunch. Are you ready to go?
Well, I could go, I guess, if you want me to, but I don't know where we're going.
Are you hungry?
Oh, eat. Well, yes, I'd like to eat. Now, what was different about that very last thing that she did? She decided to use a visual cue. And one of the most wonderful things you can ever do is learn the difference between verbal cues and visual cues and commit yourself to more visual and less verbal. What we want to do, instead of saying, what do you want to wear? Would you rather wear the pink outfit or the blue outfit? Do you want an orange? We could get either turkey or chicken for supper tonight, not what do you want off the menu? It's overwhelming. It's just too much, too many words, too much going on. So cutting back on how much we talk, really critical. But the other thing we need to be real careful of is we're very good at giving visual cues, but sometimes we don't realize we're doing it. Okay, you ready? So follow my visual cues, not what I say. Okay? We're at the doctor's office. All right? And I'm the doctor and you're the patient. Judy, hey, Dr. Snow, you doing okay? Yeah. Now listen, last time you came in, I started you on that new sleeping medicine. Are you still taking it?
Yes.
Yeah. Having any problems with it? Nausea, vomiting, any side effects at all? No. Does it seem to be helping?
Yes.
Is your daughter getting more sleep?
Yes.
That's great. That's great. Any problems with it at all? No. No, that's terrific. Now I have you on 3 other medications. Are you still taking all those?
Yes.
Do they seem to be helping with your memory and with your behavior and everything?
Yes.
Any problems that you need to let me know about?
No.
Okay, that's terrific. What's going on here?
You're answering the question.
Do I know that?
No.
Am I doing it on purpose?
No.
No. How about this one? Mom, did nobody come up here to get you out and take you down to activities?
No.
You've stayed here all by yourself all day long.
Yes.
Did anybody take you to lunch? Did you get to go down to lunch?
No.
Did they send you a tray?
No.
This is ridiculous. So you have been up in this room all by yourself.
Yes.
Did Daddy come by?
No.
Did John come by?
No.
They told me they stopped by. They didn't stop by to see you?
No.
This ticks me off. I can't. What don't I realize I'm doing? Same thing. And so we all have the risk of doing it, And one of the things, I have a neurologist friend, he says one of the things early on is he asks an opposite question of the way he moves his head to find out what's going on. And now his is this: am I wearing red pajamas? Hang on just a second, Judy. I want to speak to your daughter just a second. I'll be right back. Come talk to me. Because what did I just realize when I did that? That she's following my head motions and not actually paying attention to what I say. I'm not that blatant. Usually I'll say, am I sitting down? Because then we can laugh about it, because they'll say, no, you're standing up, which isn't quite as bizarre as wearing red pajamas, but you get the drift. In other words, I need to check out, is she actually accurately answering the question as she sees it, or is she just following my lead? Right. Understand, every question I ask that woman, though, I'm relying on what kind of memory? Immediate recall, which is the part we know she doesn't have from the very beginning of the disease. We've got to develop other strategies if we're concerned about other people doing things other than asking her, because we set ourselves up to get frustrated and end up fighting with our care partners, and it doesn't serve any purpose. So instead of emphasizing the don't, emphasize, do come back this way. Hey, Judy. Hey, how are you doing? And get her to turn from the door by giving her another target. Instead of don't take your clothes off, well, hey, you look hot. But notice when I do this, I stop the action of undressing, but in a very friendly manner, which is real different than, don't take your clothes off, which makes it sound like she's doing something wrong. And people, even if they have the dementia, don't like to have people think they're doing something wrong. Take a look at this picture of the brain. This one's a kicker. Watch this. This is a center cut right down through the middle of your brain. And this is a real important part of your brain. It's right here. And it has lots of parts to it that are real important. Here's the first part. This is the language center. This is your ability to use words to get your meaning across. This is your ability to get people to understand you. It's also your ability to actually produce speech. But it's your ability to use language to express your needs, your thoughts, your beliefs, your values, your history. Everything, all of your language center is in this general area here, this chunk. And this is all you have left of that whole area by the end of the disease. So these folks will go from being able to, I would like the car keys, I want to go driving, I don't understand why you're giving me such a hard time, to, look, you know the where you put the, where are the, you use them to drive the car, you know the keys, of course the keys, and I also need to pay the bills, so I need my yes. And the first thing I'll miss are my nouns. I lose my nouns. I lose my naming. And so I can't name objects. And I get frustrated. Now notice I work my way around them because I know what I'm talking about. I simply can't find those words in that moment. The other thing that might happen, rather than not being able to find them, I misname them. And I get what's called word salad. Look, I need a fresh pert.
Part?
Pert. Pert. Do you speak English?
Yes.
Well, it doesn't sound like it. You must be from another part of the country. Smartass. Now, we're going to get to the swearing in just a second. But now, when I say pert, and it's not a word that you're familiar, what is your gut reaction to that? What do you want to say? What's a pert? What do you mean? If I could tell you that, I would have used a different word. And so that doesn't do us any good. This is, again, where as a caregiver, you can't react. You need to respond. So the first thing you're going to do is connect and say, Teepa, hey, you need a fresh pert. Say what I'm talking about, but say it, put a question mark on it. You need a fresh pert. Okay? Then one of two options for you. Number one, tell me more about it. Because that's non-confrontational. Tell me more about it. You're looking for a fresh pert? Tell me more about it. Because it just means I didn't quite get what you need. And that gives, it's an okay thing. The second possibility, can you show me what you do with it? Can you show me what you do with it? Changes it from words to actions, and they're better at actions than they are at words. So let's try that and see how that goes. Hey, I need a fresh pert.
Tell me more about that.
First you say, you need a fresh pert.
Oh,
Then why do you want to say that first?
So they...
Bingo, yeah. So they realize that you actually heard what they said, and you're not ignoring them. You actually are going to re-answer their question. I need a fresh pert.
You need a fresh pert?
Yes, I do.
Okay, tell me more about that.
Well, this one's dirty.
Oh, okay.
So what would we go do?
We go down to your room
And get a fresh shirt.
Right.
And it's often a sound-alike word initially. They know what, it's sort of like a sound-alike. Here's one that somebody did for me, one of my favorites ever. Honey, have you seen my pedurtle? And that's exactly my reaction. I went, oh. And now what are you going to say now that you've thought about it for a second?
your pedurtle.
Yes, my pedurtle, yes.
Tell me a little more about it.
Well, I've got two of them. A light-colored one and a dark-colored one cause of Easter. Yeah, if you could just see the uh-oh, and what I will tell you, one of the realities of being a caregiver is first you have to have the uh-oh before you get the aha. Okay, there is no way to have an aha if you haven't had an uh-oh. And what you just experienced was the uh-oh. I mean, it didn't help, did it? I mean, I described this and it's like, uh-oh, this isn't helping. So what do you go to? Second strategy. Can you show me what you do with it? Go to your second strategy. When the first one doesn't turn, try your second one.
Can you show me what to do with it?
Well, yeah, I put it on my arm when I go out and I can pay. A dirtle. So go, oh, you're a dirtle. And what do we go look for? My purse. Because now think about the whole sequence. A light one and a dark colored one because of Easter. What do? You change pocketbooks at Memorial Day and at Labor Day. I mean, we change pocketbooks and when I put it on my arm to pay. You got to start speaking Alzheimer's as this disease progresses because they're doing the best they can. It gets harder and harder though, okay? And it will come to a point where you really have to know your person because it's not just nouns, it's everything's getting real vague. You know that one who comes down in here? When is that? The one, look, here, listen. You know that one that comes in with it?
The one that comes in?
Yeah, that's the one that I need that with the one. I need that one to come on.
Okay. Tell me more about that.
Well, you know what it is. Look here. Now what's starting to happen? Why am I getting upset?
They don't know how to describe it any longer.
I've lost all my words, and I'm looking for you to do what?
Fill in the blanks.
Fill in the blanks. What are you having trouble with? I mean, the blanks are huge, and you're going, oh my God, I don't know what to put in here. You did a really nice job of using some of my words. What you didn't do is connect to me and get up and turn sideways. Because what did you notice I started doing?
Right, yeah.
I don't respect your space because I'm getting frustrated. And what am I starting to get? Confrontational. Who's got the big brain? So what you want to do is control the situation. So when I'm starting to approach you, you're going to want to go ahead and stand up and turn your body sideways so that you can control this interaction. Because if you have my hand and we're moving along, that thing that goes, you can take this hand and point us and move us because now I am distractible. It is easier to distract me with what kind of things? Visual, because I'm very tuned into the visual. And if you know me and you know I love decaf coffee, even though I don't know you don't know exactly what it is I need right now, you can possibly get me connected. So this is where you're having to get smarter and smarter because my damage is getting more and more severe. Now, disease gets worse. One of three things will happen. I might go silent. I might have a medium range of producing language, not information, but just language, words, or I might have a high intensity. So I'll show you what these look like. How are you doing? Yeah. That's very low intensity. And all of a sudden, out of the blue, notice that I came up with, hey, how are you doing? We'll talk about that in a second. That's because on the other side of your brain, there's a preserved area. There's three things in there: automatic speech, music and rhythm, and expletives. It's a preserved chunk of brain. So that was silent, very little language. Here's a middle person. And put it down, and you pick it up and put it down, and that'll give you the thing, and then there it is there. That it is, one there is, and you got it down, and then that'll, you pick down, and you put it down, and then suddenly, and then he went and he did it, and that's the one that you got. Yeah, batty. batty. Coca-Cola, Pepsi-Cola. Yeah. And I'm sort of chattery, but I'm not noxious about it, but I'm sort of chit-chatty. I might also instead be high intensity. Hey, come here, nurse, hey. Now, that can be real annoying. Do I get to choose? Do you get to choose? It's what you choose to do with it, but I'm doing the best I can. I have huge brain damage at that point. Now on this side over here, as I said, we've got automatic speech. We've got rhythm and music. Now what this means, this is a blessing, because music and rhythm is one of the last skills that they'll lose. We need to learn how to use that. And it's music from childhood, adolescence, and young adulthood. We need to learn what were their music from that time period. And these folks can literally sing when they can't talk. They cannot put a sentence together, and they can sing. All you have to do is help them get started. And they will sing. And not only will they sing, they have rhythm. And so they can hardly walk. And if you do this, they all of a sudden will start doing it. And so you say, don't sit under the apple tree with any... And they'll get up and they'll dance with you. I mean, and these are people that are barely moving with their walkers, and all of a sudden, here they go, because we're using a part of the brain that's preserved. A wonderful gift. It's also prayer, and it's also poetry. Everything that's done with music and rhythm. Those are things that we have. They also do very well with things like a stitch in time saves, bird in the hand is worth two in the... Fill in the blank kind of things, where what we're doing is using a rhythm and a pattern and something that makes sense. 2, 4, 6. They can get that stuff. And they feel good, because all of a sudden I'm smart again. I'm intelligent. I know the answer. And that's a nice way to feel, instead of like I'm stupid, I'm dumb, and I can't do anything. The third thing over there are the expletives, and expletives come in a couple of varieties. What we're talking about is swear words, sex words, and racial slur. These are the forbidden words. This is the forbidden section of your brain. This is where you store things. And your first swear word, typically we learned between 2 and 7. We were 2 to 7 years old. We went somewhere, we heard it. We came home, we said, hey, Mom, shit. And in one lesson, your mother taught you never use that word in front of me again. And you never have in front of your mother said the word, but you've also never forgotten the word. You put it over in the right-hand storage section marked, whoa, hang on to this sucker. This is quite a word. But you decided not to use it in front of your mom. You learned a lot more of those words, and then between the ages of 7 and 10, you learn the art of what's called word substitution. It's where you know a word, but you choose another word to use out in public. And it's not just what's called vulgarities, it's also blasphemies. And that's often very hard for families and for church or faith members of the faith community, synagogues. It's really tough for them, because this is a person who's supposed to be faithful and Lord, listen to what she says. It's not her. That's all the disease. That has nothing to do with that person. And actually, the people who did absolutely none of it are the ones who are most vulnerable to having that be really vocal. Makes it be really rough. And then there's the sex talk. That's embarrassing. Yikes, did you hear what she said? Yeah, that's exactly what she said. I've had a priest say something and I just went... And what you have to understand is it's not history, it's not any kind of background, it's simply that they know the words and they'll come popping out because they don't have anything else. The third thing that's up there is the racial slur, or the other group kind of slurs. That's important to understand, because what's going to happen is they're going to say things about other people. And it's not just racial, it's also mean things. So I might say something like, hey, you fat one, come here. Boy, you need to do something with your hair. That looks like shit. and they will also say, honey, are you pregnant? And you're just thinking, ooh. Well, that happens not only because of these issues, but here's the last picture of the brain I want to show you. This is one. This is the front of your brain. And this is the part of your brain that that allows you to be the person you choose to be. This is the control center for your impulses. This is your ability to pull back from situations and to think things through before you act. And what happens is that frontal and prefrontal cortex is not there. It's simply not there. And so what you would normally have done is say, ooh, that's rude, I shouldn't say that. Now whatever comes into your mind comes out of your mouth. Any kind of thought you have, like, oh, gee, I'd like to walk outside and pee because I've really got to pee and it's really a long way to the bathroom. Now with the disease, I'll just do it. I don't pull back. I don't think it through. I don't consider the alternatives. I can't see things from your perspective. And you'll say, but Mom, you told me you never wanted me to do this. Well, I've changed my mind. Actually, I have not changed my mind. What's happening is my dementia is taking over my decision making. And I can't not say whatever comes into my mind. And that's really hard for caregivers because frequently what will happen is it's time to put me in a location because you can't do this 24/7 anymore. And when you're about ready to do that, I say, I don't believe you're doing this. Why are you doing this to me? Don't do this. Please, sweetheart, I'll be good. Don't do this. Why? I don't understand. I took care of you when you were little and looked at you. Why are you? And we had talked about this. If I ever got to a point like when my mom did, and I don't want you to ever do this, I promise you, no matter what I say, please make sure you do what's right for you and your children. I do not want to be a burden on you. And when the time comes, trust me, I won't be able to tell you that. Not because I don't mean and I don't want to tell you that, but because my brain is so damaged at that point, I can't tell you that anymore. And it's not me being ugly, and it's not me not wanting it. It's the disease destroying the part of me that allows me to have that skill set. I just don't have it anymore. But I still want to be respected. So one of the things you can say is, Mom, this is breaking your heart. And I know that. And here's what I want to tell you. It's breaking mine too. And that's called empathy. And it's hard. I mean, it's hard to have that conversation. I wish the doctor would let me take you home, but he says absolutely not. I can't do it. And realizing that that's part of the disease process is being able to be honest about that emotional thing. I just can't do it. It's breaking my heart. Say that out loud because people with dementia still want to be respected and they still want that. But what they can't do is be rational anymore. And we really want them to be rational because it makes us feel more comfortable. We've been talking about the language down here at the bottom. But up here on the top of your brain, this is an incredibly important part of your brain up here. These two sections right here. And there's a left side and a right side. And it controls sensation. Coming in, it actually registers sensation from the very bottom of your feet all the way to the top of your head. And it puts a map of all that sensation on your body, on your brain. It's called the sensory strip. And that is also what happens is the sensation comes in on the surface of your brain, on the cortex of your brain. And then what happens is the information gets picked up by the white matter in your brain. This is white matter. This is gray matter. White matter is what sends messages from one part of your brain to the other. It's called a telegraph system. It actually connects one part of your brain to another. It's the channels that allow information to get sent from one place to another for processing and interpretation. So sensation comes in and it gets sent to other parts of your brain for interpretation and understanding. And then a message gets sent out through this same system out to the surface. This is also your motor strip, which is the strip of your brain that allows your body to do something about the sensation that you experience. So both of you have been experiencing the sensation. You've been sitting, and you put your weight on one cheek, and the cheek sends a message up, hello, we're running out of oxygen down here. And your brain goes, oh, okay, well, fine, here, shift your weight. And so it sends a message back down all through your body so you can shift your weight off that one hip and put it over on the other side. Neither one of you, during the course of that, went, ow, my butt hurts. Oh, that's too much pressure. Oh. And none of you fell out of the chair when you were sitting there trying to shift your weight. You're very skilled. I have the same skill because my brain is more like this than like this. So I'm getting thirsty. I remember I set a thing of water over here. I can reach out. I'm not even looking at it. I can judge how much weight's in it because I have that awareness. I pick it up. I figure out a pause point. I take a sip and set it back down. All of that happened because I have an intact sensory motor strip. Look at how little white matter there is over here. So what happens? Look at all the damaged areas is where sensation is getting registered. So what happens, I don't know What's wrong? I just know something's wrong. And I don't know what to do about it. And hey, listen, help. Please help me. Yeah, okay. And then I throw it at you, or I dump it on the floor, and you're like, okay, well, I guess she wasn't thirsty. Here's the problem. I was. I can't remember this is water and how to take a drink. I mean, as simple as that seems, that took a connection in my brain to go from thirsty to bottle to hand to mouth. And that's where when we did the hand under hand, and I actually guided your hand, what I'm doing is helping you find that strip that connects the sensation to the movement and how to meet your needs. But as this disease progresses, I have to take over more and more responsibility for helping your brain get from place to place to place, not because we don't want it. And what it also means is I could actually be really tired and keep walking because I don't know how to stop. I could be hungry, and if you just put it out there, I might just push it off. I might need to pee, and I don't know what's the matter. Can I help me, please? And if you try to take my clothes off, I don't understand taking clothes off and me being uncomfortable. So can you ask me, are you hurting, Teepa? Do you want something for pain? PRN pain medicines aren't going to do me any good. What you need to do is go ahead. If I'm 85 and I've had arthritis, hello, and I'm walking a lot, go ahead and give me Tylenol every 4 to 6 hours. Don't ask me about pain. And if my behavior is getting more distressed, consider your first option instead of an antipsychotic or an anti-anxiety med, try a pain pill, Tylenol. I mean, it doesn't have to be anything heavy duty. Just let's take into consideration maybe it's pain, because I'm not going to be able to let you know about that. And there are 4 zones of the body that you want to really be sensitive to, because these 4 zones are often ones that actually have some potential to cause trouble. These areas are so well represented on your brain that when there's a lot of damage, these are still represented on your brain. Number 1 is lips, tongue, and mouth. Second is palms of the hands and the fingertips. The third is the soles of the feet. And the fourth is genitalia. And we want to talk about 2 things, sensory need and sensory tolerance. Sensory need, I need to be touched and I need sensation. If I need sensation and I'm low need, I'm going to be if I'm medium need, I'm putting all kinds of stuff in my mouth, nibbling on it, chewing on it, spitting things out. If I'm high need, I'm grinding my teeth. I might put things in my mouth and crunch or chew. I might bite on my clothing. I might do things. May not be pain. It may just simply be because I have high need. My arms and my hands, low need. And then pity, and look here, look. Do you see it? Do you see it? There it is. Oh, yes. Oh, looky here. I got that. Yeah. And there it is. And that is the thing. You can get that, yeah. And I'm all about fiddling and messing. If I'm high need, hey! So with this, we have need and then we have tolerance. And when it comes to caregiving, if we're trying to get in a person's mouth a lot and they have low tolerance, that's where we run into trouble. That's why earlier on we learned the hand under hand. This is why it's so important. Because if you have their hand going with you, sensation is diminished. If all of a sudden out of the blue I'm starting to touch, eeks. It's also why we want to have that second point of contact, because we trick her mouth into not paying so much attention to the touch here. I take that away. This is highly intense. Same thing down here, same things on here. So just paying attention to that kind of stuff. Well, I hope it's been helpful. Hope you had fun. Well, you are so welcome. I appreciate you coming out, and hopefully what we've talked about can help you make a difference. It's what I'm all about. So thank you all.
Thank you.
You are welcome.